Welcome to Yoga and Anatomy Basics as it applies to our prenatal yoga teacher training. In this class, we will understand the body in movement and in stillness. Why anatomy matters. It helps to prevent injury, informs safe alignment, deepens awareness of body mechanics, and enhances the mind-body connection of your student and yourself as an informed teacher. The skeletal system in yoga provides support, bones act as levers, and individual skeletal systems differ from person to person. Bones to know. There are about 206 bones in the human body. The human spine typically consists of 33 vertebrae and are divided into regions. These regions are cervical, thoracic, lumbar, sacral, and coccygeal vertebrae. The cervical bones are in your neck, and there are 7 of these bones that connect the head to the body. The thoracic spine consists of 12 bones from T1 to T12 and are in the upper back. Lumbar vertebrae consist of 5 bones and are in the lower back. There's 5 fused sacral vertebrae and 4 fused coccygeal vertebrae. Here are the basic bones and what they do. The collarbone or clavicle. Pause to read. The shoulder blades or scapulas. Pause to read. The hip bones. They're made of 3 parts, the ilium, ischium, and pubis. This helps support spinal alignment, protect the reproductive organs, and is a key role to structure and movement. Here is an image of the pelvic girdle. Now, you do not need to know every single one of these bones, but you will often hear them referred to. Sits bones, one of the most popular bones referred to in yoga. These are the ischial tuberosities, highlighted in red. These are at the base of the pelvis and support the body weight when seated. They serve as an attachment for your pelvic floor muscles and hamstrings. So, as you can imagine, these are very important bones to pay attention to during pregnancy. The femur bone is the longest and strongest bone in your body, also called the thigh bone. Pause to read. Muscles to know. There are over 600 muscles in the human body. We are going to highlight some of the big ones. SCM, sternocleidomastoid, is a prominent neck muscle that helps turn the head and supports head posture. Pectoral or chest muscles. Located at the upper chest, these are under the breast tissue on women. They help to move the arms and support breath and shoulder stability. Trapezius muscles of the upper back, and the latissimus dorsi muscles. Biceps and triceps of the arms. Transverse abdominis muscles, those deep core muscles, innermost abdominal layer called the corset muscles. They support stability and help with breath control. We will do a deep dive in the core chapter on these. The erector spinae are the muscles along the spine, a group of deep muscles that extend the spine and support posture, back bending, and spinal alignment. The glutes. These are the buttocks, made up of the maximus, medius, and minimus gluteal muscles. They stabilize the hips and are a big component of strengthening the pelvic floor. Now here's the group of hip muscles. Pause to read. Adductor muscles of the inner thighs are really important during pregnancy because they help to stabilize the pelvis and can help reduce pelvic girdle pain and pubic symphysis disorder. Pause to read. The pelvic floor muscles. We will do a deep dive into these in the pelvic floor chapter. Pause to read the description. Hamstrings, back of the thigh. They flex the knee and extend the hip, important for forward folding and stability. These can get kind of tight during pregnancy, so we would like for them to stay flexible and supple and move with ease. Quadriceps are the front of the thigh. It's a group of 4 muscles that extend the knee and support strong standing and balancing postures. The calf muscles of the lower leg are involved in toe pointing and stabilizing standing poses as well as supporting balance. These can also get tight during pregnancy, so we want to give them special attention. Ligaments of importance. These are important ligaments during pregnancy and the ones that we often find affected. The round ligaments. Pause to read what they do and how we can pay special attention to them in yoga and pregnancy. You'll hear the round ligament mentioned often, and as you can tell, this ligament has a big job to support the uterus. It is often affected most in the 3rd trimester of pregnancy. The broad ligaments. These ligaments act like a sling and run across the front of the belly. They support the reproductive organs and help maintain an upright position. You will often see women who are having broad ligament discomfort wear pregnancy support belts. This is them, the wings below the ovaries and on either side of the uterus. As you can imagine, they have a big job during pregnancy. The uterosacral ligaments, connect the uterus to the sacrum, so are in the posterior or back part of the pelvis. We really want to pay attention to these because sitting and poor posture and sitting and lying down and driving can twist up these lower sacral ligaments and cause some discomfort in the abdomen and also affect baby's position in utero. Here are some images. Finally, the sacrotuberous ligament connects the sacrum to the ischial tuberosity, the sits bones. So these ligaments are important to keep strong yet very flexible. Sometimes they can hold a lot of tension during pregnancy. So things like rolling on a myofascial ball on these ligaments can help relieve tension, and several yoga poses can help them move with flexibility and ease. Pause to read.